We've done a couple of videos on time frame to return to normal action. And I think it's very important for us as surgeons to educate the patient what the time frame for return for a total shoulder is, okay? And you can break it down into the same phases we had before, but as we discuss somebody's having a shoulder replacement, it's our job to make sure they understand the time frame when they're gonna be back living, working, playing the way they wanna live. So the time frame for total shoulder goes something like this. There's not usually an acute injury. There's usually a slow progressive loss of function and increasing in arthritis. We hopefully have maximized your conservative treatment. That means therapy, injections, anti-inflammatory, and avoiding actions that hurt. But if you're having severe pain at night, if you can't do the things you want to do, and you've been indicated for a shoulder replacement, this is the time frame. So the injury pre-surgery time, it's crucial for shoulder replacements because one of the main factors is you got to have medical clearance. And what that means is your primary care doctor needs to make sure heart and lungs are good. You have to have a hemoglobin A1C of less than 8, and what that means, you have good glucose control. We of course will look at your blood count to make sure that's going to be safe. So some medical clearance by your primary care doctor or your cardiologist or your pulmonologist, whoever we need to do to make sure that you're medically safe to have surgery. The second thing is preoperative templating. We get the appropriate x-rays, we get the appropriate CT scan, we get the appropriate MRI scan to know what you need. We use the CT scan in our software templating. We can virtually do your surgery before we ever do your surgery, and that helps us with implants and making sure that implant goes in perfect. And the last thing is getting ready for the surgery. You will feel more comfortable if you're sleeping in a recliner and you're really on one floor, and you need to make sure you have a coach or a family member that's going to be there to help you, and you're probably going to need some pain control and some constipation meds the first 3 to 4 weeks. Some people don't have any pain, some people have pain, but you got to get ready. So that's all the pre-surgery preparation. I think that's crucially important. Medical clearance, our preoperative templating, and you getting your nest ready. Next is surgery. Now, hopefully we've had that discussion in clinic. Surgery is either going to be as an outpatient surgery, where you come in and you have your surgery and you go home the same day. A lot of that will depend on your medical issues, pain control, blood pressure control, but probably 80% of the shoulder replacements we're doing now are outpatient. 20% require a 23-hour hospital stay, and that's a discussion we have before you ever go to surgery. So after surgery is phase 1. Phase 1 is the maximum protection phase. Usually we've had to take down at least part of the rotator cuff, and we're allowing that rotator cuff to heal, and that takes approximately 4 to 6 weeks. That's the tough time because you're in a sling, you usually sleep in a recliner, you're trying to control your pain. Along with that pain control becomes constipation control. You're using ice. Also during that time you can't drive, and we don't want you traveling because if you have trouble we can't get to you. That's phase 1. Phase 2 is the intermediate phase. We are assuming that rotator cuff we took down is mostly healed, and we're beginning to work on more motion and more strength. This becomes a hard time because there's usually no sling. We tell you 5 to 10 pound weight limit. Your function should be between waist level and shoulder height. That means you can manipulate on a tabletop, but you should not be yanking up off the ground or lifting heavy overhead. And the most important thing, when you're out of your sling, don't be a knucklehead. Don't be lifting heavy stuff because you can tear this thing up. The final phase of shoulder replacement is phase 3, and that's when we're trying to maximize your range of motion, maximize your strength, and this is a progressive strengthening using physical therapy. And in some people that have more aggressive goals, sport-specific training, if you're trying to tennis, if you're trying to swim, if you're trying to get back to sport-specific kind of stuff, that's a phase 4. We're working on that. But usually recovery from a shoulder replacement is 3 to 4 months. And if you're trying to get back to more aggressive sports, it can be up to 6 months. Now, the most important thing is if I put metal and plastic in your shoulder, whether it's an anatomic total shoulder or a reverse total shoulder, you may have some limits and you may have some achy pain. It's hard to make a perfect shoulder by putting metal and plastic in there. So expectations of time frame to healing and expectations of your outcome are crucial.